In the name of God, hello and welcome. I'm Ali Zamaradi and you are watching IRIN in English News, coming to you live from Tehran. The number of people who have fully recovered from the coronavirus infection in Iran is about to hit 50,000 people, while the daily death toll from the disease was below 100 for the second day in a row. Speaking at a press conference on Wednesday, Iranian Health Ministry's spokesman Kianush Jahanpour said COVID-19 has taken the lives of 94 patients during the past 24 hours, down from 98 a day earlier and marking the lowest number of deaths since a month ago. He said the coronavirus death toll in Iran now stands at 4,777. Jahanpour added that 49,933 patients have recovered from coronavirus infection so far and have been discharged from hospitals. The spokesman said the number of people tested positive for COVID-19 across the country has risen to 76,389 following the detection of 1,512 new cases since Tuesday noon. He said among the coronavirus patients undergoing treatment in hospitals at the present, 3,643 are in critical conditions because of more severe infections. The spokesperson also noted that 299,204 coronavirus diagnostic tests have been carried out in Iran so far. Now, Iranian President Hassan Rouhani says Iran is going to have a good year, as all predictions suggest that the country's economic growth will be positive in the next Iranian calendar year 1399, which began on March 20th. Addressing a cabinet session on Wednesday, Rouhani said the status of agriculture and agricultural production in the country during the current Iranian year will be better than the previous years. The president said a report from the Central Bank of Iran forecasts that the status of inflation will be better than the last 2 years. He also dismissed foreign media reports that Iranians are suffering hardships, stressing that a good year is ahead despite the problems caused by the sanctions and the outbreak of the coronavirus. In February, Deputy Governor of the Central Bank of Iran, Peyman Ghorbani, said a downward trend in the inflation rate in Iran and the improvement in the country's non-oil economic growth will continue in the year 1399, which falls on March 20, 2020 through to March 20, 2021. Now, amid the COVID-19 pandemic, rights groups are calling on European governments to act before it is too late. In Greece, refugees who are diagnosed with COVID-19 are quarantined, but in crowded and unhygienic conditions. Here's more.
For those who have fled war and hunger hoping to find sanctuary in Europe, COVID-19 is just another thing that might take their lives along the way. The World Health Organization insists physical distancing and a lot of testing continue to be the best ways to fight the spread of the virus. So overcrowded detention centers with shared facilities and inadequate healthcare at the best of times are a nightmare waiting to happen. Doctors Without Borders says all the medical care here is provided by NGOs and volunteer doctors, and those who are suffering are often children.
Out of 70,000 people, 6,000 are minors. 1,200 there are unaccompanied minors. This is the most vulnerable population that needs to get medical treatment. And here in the island, medical treatment they need is not available. We have children treated and seen by our team of psychologists every day. They start to withdraw from their basic behavior. They stop eating, they stop sleeping, they have nightmares, they stop relating to each other, they stop playing.
Human Rights Watch is calling on Greece to release hundreds of unaccompanied migrant children in police cells and detention centres. Aside from the abuse and unhygienic conditions, they are now in danger of contracting COVID-19. Various European nations have agreed to take in 2,000 children, but as for the UK, even unaccompanied children who have permission to join family in Britain are being refused assistance. Amid travel chaos, Home Secretary Priti Patel responded to a plea by Doctors Without Borders, saying the UK would continue to support the implementation of the EU-Turkey deal. The NGO has described the response as shameful, arguing that the deal is essentially a containment policy.
This cynical deal traps thousands of people, many of them children or deeply vulnerable, in squalid conditions on the Greek islands.
Meanwhile, Greek forces are on heightened alert. Reports state Turkey is preparing to push a fresh wave of migrants towards Europe. More than 6,000 European doctors have signed an appeal calling on EU governments to bring refugees safety. What they need are the basics: a regular supply of water and soap to wash their hands, and the luxury of sleeping 2 meters apart. In the absence of these, a chronic emergency is imminent. Bianca Rahimi, Press TV, London.
Now, U.S. President Donald Trump's move to freeze America's funding to the World Health Organization, or the WHO, the body leading the global fight against the new coronavirus pandemic, has drawn global censure. China, where the first virus emerged, said on Wednesday that the United States had to fulfill its obligations to the World Health Organization at a time when some 2 million people were ill with COVID-19, the disease caused by the new coronavirus. My colleague Omid Heydari has this scoop.
Chinese Foreign Ministry spokesman Zhao Lijian also said at a regular press briefing that the U.S.'s refusal to contribute funding came at a critical stage that would affect all countries in the world. Trump, who is under immense pressure for his slow and inadequate response to the American outbreak, said on Tuesday that he had ordered a halt to the U.S.'s funding to the WHO because of what he alleged to be the body's mishandling of the global health crisis. Over 607,000 have been affected and more than 28,000 have been died in the U.S. so far. Individual U.S. states have taken over the management of the crisis, often breaking with the federal administration, which continues to act in an underwhelming fashion in responding to the outbreak. Zhao, the Chinese Foreign Ministry spokesman, was asked whether China would step in to fill the shortfall in WHO funding caused by America's withdrawal of its aid. The U.S. is the biggest overall donor to the Geneva-based WHO. In 2019, the U.S. contributed more than $400 million to the body, roughly 15% of its budget. The WHO has been leading the global fight against the pandemic. Its experts have been working to develop vaccination for COVID-19, issuing guidelines on the specific measures to contain the spread of the virus, and coordinating countries' individual efforts. The U.S.'s freezing of its aid funding now risks undercutting the body's measures as the outbreak grows in almost every country in the world. Separately, on Wednesday, German Foreign Minister Heiko Maas said on Twitter that assigning blame doesn't help. The virus knows no borders, in an apparent reference to Trump's assertion against the WHO. New Zealand's Prime Minister Jacinda Ardern also defended the WHO. Australian Prime Minister Scott Morrison said he sympathized with Trump's criticism of WHO, but added that the WHO does a lot of important work as an organization. Meanwhile, United Nations Secretary General Antonio Guterres said it was not the time to reduce resources for WHO operations. Amish Adalja, an infection disease expert and senior scholar at the Johns Hopkins Center for Health Security, said the Trump administration's move sends the wrong message during the middle of the pandemic. American Medical Association President Patrick Harris also called Trump's move a dangerous step in the wrong direction that will not make defeating COVID-19 easier, and urged Trump to reconsider. Separately, the EU's top foreign policy official, Joseph Borrell, condemned a decision by President Donald Trump of the United States to suspend Washington's funding of the WHO. The European Union is set to hold an online fundraising conference next month to support the creation of a vaccine against the novel coronavirus. The conference will be held on May 4th in close coordination with the World Health Organization (WHO). European Commission President Ursula von der Leyen said at a joint press conference with the European Council President Charles Michel on Wednesday. The International Monetary Fund has also warned about a new wave of social unrest around the world as a result of the economic stress caused by the COVID-19 pandemic.
And India's poor are hit the hardest as Prime Minister Narendra Modi extended the lockdown until May 3rd. Here's more on that.
As coronavirus pandemic grips the entire globe, in this part of the world, it is yet another misery for millions who live hand to mouth. While the majority of businesses in India have been ordered to close, millions of low-paid workers in the private sector are left jobless. These people now have to bear the consequences of a coronavirus lockdown and fight for survival.
I'm not sure if we live or survive. This lockdown will kill us as we have no means of livelihood. The government is running community kitchens and some cash handouts, but it is not reaching everyone. They could have planned the lockdown so we could reach our village rather than dying here. They announced a sudden lockdown without thinking about what will happen to people like us. You know, we hardly get food to eat, and if we do once a day, we are lucky. My wife worked as domestic worker, but now they have stopped her for coming to work. I don't know if we live.
In a televised speech on Tuesday, Prime Minister Narendra Modi extended the 3-week-old lockdown until May 3rd. Modi acknowledged that the lockdown will have a heavy economic toll on the country, but he stressed that the restriction is necessary to save lives.
From the economic perspective, we have paid a big price, but the lives of the people are more valuable. Our efforts are being lauded across the globe. If we had not acted swift, it is frightening to think what situation would have been.
Based on official figures, there has been more than 10,000 cases of infections and around 350 deaths in India. But there are fears that the number could skyrocket and overwhelm India's ailing healthcare system. According to the government, if the timely lockdown was not imposed, the number of coronavirus cases in the country would have risen to 820,000 by mid-April. Now the decision to relax restrictions depends on how the coming week unfolds. Munawar Zaman, Press TV, New Delhi.
Well, that's it for me now. Thank you very much indeed for staying with us. Good night.